What are the risks of autonomic function testing? When considering autonomic function testing, especially for those with Parkinson's disease, it's important to understand the potential risks involved. Autonomic function testing is a series of procedures that evaluate the autonomic nervous system, which controls involuntary functions like heart rate and blood pressure. In Parkinson's disease, many patients experience autonomic dysfunction, making these tests valuable for assessing symptoms. However, like any medical procedure, there are some risks to be aware of. One of the main risks is transient cardiovascular effects. Tests such as the head-up tilt test or the Valsalva maneuver can cause temporary changes in blood pressure and heart rate. This might lead to symptoms like dizziness, lightheadedness, or even fainting during or shortly after the test. Fortunately, these effects are usually brief and resolve quickly once the test is stopped or the patient is returned to a resting position. Another risk is the potential for orthostatic hypotension provocation. Many individuals with Parkinson's already have issues with blood pressure regulation, particularly when standing up. Autonomic function testing can temporarily worsen this condition, increasing the risk of falls or injury if the patient is not closely monitored. Discomfort or anxiety is also a possibility during these tests. Some patients may feel uneasy, especially during procedures that requiring sustained breathing or prolonged standing. This emotional response is important to acknowledge, as it can affect the overall experience of the testing. While rare, there are more serious risks associated with autonomic function testing, such as arrhythmias or severe hypotension. These risks are more likely in patients with existing cardiovascular issues or severe autonomic failure. However, conducting these tests in controlled clinical settings with proper monitoring significantly minimizes these risks. It is also essential to recognize the limitations in interpreting the results. Autonomic function tests may sometimes yield false positives or negatives. This means that careful clinical correlation is necessary to avoid misdiagnosis or unnecessary anxiety for the patient. In the context of Parkinson's disease, autonomic function testing is generally considered safe and beneficial for monitoring disease progression and guiding treatment for autonomic symptoms. The advantages of accurately assessing autonomic dysfunction often outweigh the minimal risks when tests are performed by experienced healthcare professionals. Patients undergoing these tests should inform their healthcare providers about any cardiovascular conditions or medications they are taking. Close monitoring during the tests is crucial for ensuring patient safety. Overall, autonomic function testing is a reliable and relatively low-risk tool for evaluating autonomic nervous system impairment in Parkinson's disease. It plays a vital role in comprehensive disease management while prioritizing patient safety through careful procedural protocols. Always consult with healthcare professionals for personalized advice and information regarding your specific health situation.